A new year and January 2021 signalled the beginning of a new focus in the fight against COVID-19.
With our vaccine suppliers, we are now in a position where we believe we'll be able to commence vaccinations of high priority groups in mid to late February.
Almost 1 year to the day the district recorded its first COVID case, the region's first vaccination clinic opened at Wollongong Hospital. Infectious diseases specialist Dr. Niladri Ghosh, the first person to receive the vaccine locally. The district's COVID vaccine rollout was swift and strong, with more than 10,000 doses administered by April. By May, COVID case numbers had significantly steadied in New South Wales, the risk of transmission was reduced to low, and masks were on the decline. Sadly, it wasn't to last.
New South Wales is tonight back on edge. As of 2 hours ago, masks became mandatory on public transport again, and other states have now slammed their borders shut.
But the biggest scare tonight, the city staring down a potential virus super spreader.
I'm not going to pretend we're not concerned about what might happen in the next few days.
The Delta variant of this virus is proving a formidable foe. It's twice as transmissible, and all of the measures put in place are aimed at stopping its movement and potential moments of transmission. There have been 6 cases in our district, all linked back to the Bondi cluster.
A New South Wales Crisis Cabinet meeting agreed to extend stay-at-home orders and restrictions until July 16 for residents of Sydney, the Blue Mountains, the Central Coast, Wollongong and Shellharbour.
Good morning, everybody. As we suspected, New South Wales JPM last night had 97 cases of community transmission.
We're now more than a month into this latest COVID outbreak, and the situation continues to escalate. The district continues to lead the way in terms of vaccinations, and this week we hit a milestone of 50,000 doses administered. Whilst vaccination is key to our long-term journey, the focus of the state right now is on testing. There have now been more than 2,500 locally acquired cases reported since 16 June, and most tragically, a number of people have passed away.
Greater Sydney will be in lockdown for a further 4 weeks till the 28th of August. That includes all of Greater Sydney, the Central Coast, the Blue Mountains, Shellharbour and Wollongong.
The week has continued to deliver record COVID positive case numbers in New South Wales. For Islid, our mass vaccination centre at Wollongong is continuing as planned and will open next month. The COVID ward and ICU teams are currently on standby to receive patients from Southwestern LHD as required.
We have a 100% vaccination rate amongst our staff. They definitely feel safer from that point of view. All our staff have been fit tested. We've had work done to all of the ICU bays to turn them into negative flow bays, which means that every single one of our ICU bays can house a COVID-19 patient safely.
Hi, I'm Annie and I'm part of the concierge team here at the new vaccination hub in Wollongong.
This has been construction on steroids. The logistics of construction on this particular site have been enormous. Normally we have a lot more time to plan, to organise, to schedule. This is not driven by one person, it's driven by a massive team who have just committed day and night, long days and weekends to get this delivered, working like we've never worked before. And what's put it all together is everyone's commitment to actually getting this done.
Regrettably, we did have a substantial increase in the number of cases in the last 24 hours to 8 p.m. There were 356 cases of community transmission in New South Wales.
We need to further decrease mobility and the community needs to adhere to the orders. So we're still seeing a lot of unnecessary movement of people.
Category C elective surgery and endoscopy procedures will be suspended at Wollongong Public Hospital. We are in full pandemic response mode, which we will need to sustain for some time. This is the single biggest test to our health system that most, if not all of us, have faced in our lifetime. As the state's COVID positive numbers continue to rise rapidly, We have also seen a significant increase in cases within our local health district. In the past week alone, there have been 229 cases reported in Illawarra and Shoalhaven residents. The Delta variant of COVID-19 continues to impact households. We continue to provide support and treatment for those with COVID-19 through both our hospital and in-home services. This week, we've added a third layer to our response with a special health accommodation opening in the formerly vacant section of Bulli Hospital.
We're extremely happy that the Shah will be completely safe for our staff, the people within it, and the community around us.
By the end of the month, the vaccination rate in New South Wales was just over 60% double dose, but cases continued to soar.
To 8 p.m. last night, New South Wales had 863 cases of community transmission and tragically 15 people lost their lives, and we extend our deepest condolences.
There were more than 100 cases recorded for our district in the one day, a first for us during this pandemic. Sadly, in the past week, we also reported the deaths of 4 local residents with COVID. At Wollongong Hospital, our expanded intensive care and COVID ward capacity continues to meet the demand of increased patients.
The district also moved into more unfamiliar territory, taking the lead on a multi-agency response at 2 high-risk premises in Wollongong.
This action has been taken to reinforce the requirements for self-isolation and to enable it to occur in a safe and a structured way.
That I have no option but to resign from the office of Premier. My resignation will take effect as soon as the New South Wales Liberal Party can elect a new parliamentary leader. My only regret will be not to be able to finish the job to ensure the people of New South Wales transition to living freely with COVID.
After more than 100 days, lockdown in New South Wales officially ended on October 11 and signalled the beginning of the next phase of our COVID-19 response. While predicted high demand for hospitals, including intensive care units, was tracking lower than expected, the district's case numbers were growing.
In the Illawarra and Shoalhaven, the past month has seen the highest daily case numbers we've recorded since the start of the pandemic. A lot has certainly changed over the past fortnight with COVID. We've thankfully seen a dramatic drop in new cases being reported, and there have been some big changes to restrictions and what New South Wales residents can and can't do. We've been planning, preparing and responding to this pandemic for almost 2 years now. As frontline workers, we've seen firsthand the impact COVID has had on our facilities, our services, our patients and our communities. We have needed to balance our COVID response with ensuring the continued provision of our business as usual healthcare services.
November 2 and the LHD commenced its rollout of third doses from the mass vaccination hub with a familiar face. 3 weeks later, all LGAs in the district had reached 90% of double-dose vaccinations. But as November was quietly winding down,
the Omicron variant is spreading across the globe. The United Kingdom, Germany and Italy all reporting cases this morning.
I think this is just another example that COVID's going to be with us for some time. But I think this is just a reminder that there's a long journey to go.
If this pandemic has taught us anything, it's that things will change. It's more important than ever that we continue to plan for as many contingencies as possible and that we learn from our own experiences and those of others.
As 2021 draws to a close, we now again continue to wait, watch and be ready for the next chapter in these unprecedented times.
As always, please take care, please stay safe and please continue to look after each other. Thank you.